My name is Kevin Troutman. I'm a partner in the Houston office of Fisher & Phillips Law Firm. Our firm does nothing but represent management in labor and employment matters. And prior to my life as an attorney, I spent 17 years as an executive in the human resources world of healthcare. I worked in hospitals, I worked in regional offices, dealt with small hospitals at large. So I've been there, walked in the hallways, talked with the people who are in the hospitals, and understand a lot of the issues that come up. I still represent hospitals and healthcare employers. In fact, I spend probably about 3/4 of my time working with healthcare clients as an attorney. And part of that work involves dealing with unions and unions' attempts to organize healthcare workers. We've seen over the last few years that unions have increasingly targeted healthcare workers, in part because healthcare is a difficult, sometimes stressful industry, and it's changing rapidly. And change always makes employees more susceptible to trying new things like maybe a union where they haven't turned to a union before. And we've seen that reflected in the statistics. Historically, unions have been winning about half or a little bit more than half of all the elections conducted around the country in all industries. But in healthcare, they've consistently won a higher percentage of elections than in other industries. They're up to about a 70% win rate. And that's due to a few different reasons. One is that the unions trying to organize healthcare workers are good at targeting, inviting opportunities. And so they select areas where they think they're going to be successful. They'll withdraw their petitions if they don't think they're going to be successful. So that helps increase their win rate. But the fact remains that healthcare workers are at least somewhat susceptible to union organizing, maybe a little more so than in other industries. Most unions are going to want the nurses. In a healthcare facility, there are presumptively appropriate bargaining units, and nurses is one of those bargaining units. Now that in the last couple of years, that's changing a little bit, but typically you're still going to see those nurses targeted. Well, why does a union want to target the nurses? Well, for one, they can make a lot more money in dues by organizing nurses than they can by organizing people in some of the support departments. They'd have to have a lot more of those members than they would nurses. So it's critically important for supervisors, managers, administrators in the healthcare industry to recognize that unions are out there literally licking their chops because they would like to organize more healthcare workers. And the healthcare workers are unlikely to be receptive to the union's pitch as long as the workers are happy with the way they're treated. If the hospital, the nursing home, whoever it may be, if they're responsive to their employees' needs, if they listen, if they respond, then they're probably going to be able to remain union-free. If there's good, open, responsive communication, that goes a long way toward protecting a union-free environment. That the unions try to latch onto is staffing. And I always find that to be very difficult. Whenever I'm dealing with a union situation, I always ask the employees who are involved to think about what can the union actually deliver versus what they're promising. Because in a union environment, all the union can do is ask. All they can do is sit down and try to bargain with the employer. And they don't start with what they have now. They start with nothing. Both sides start with a blank slate. So the union can ask for different staffing ratios or different mechanisms for determining staffing, but that doesn't mean they're going to get it. What unions can do is turn to strikes. And some of the unions that we've seen active in organizing in the last few years, including the California Nurses Association, have been fairly aggressive in terms of calling strikes, which is not good for anybody. Certainly not good for patients, and I don't think it's good for the healthcare workers who are involved. Union campaigns tend to put a focus on, a target on the backs of supervisors. The unions have to put kind of a face on their campaign and say, this supervisor or that supervisor is the bad guy, and we're going to do something about it. We're going to change things here. And that creates a lot of we versus they, us versus them kind of environment that's not really good for particularly the healthcare industry. Unions nationwide have have made it into about 13% or so of healthcare employers. And that number has crept up maybe slightly over the last few years. But on a bigger picture scale, 40 years ago, about over a third of all workers were unionized. Today, nationwide, it's closer to 5% of all workers who are unionized. And that's because the unions haven't been able to deliver on their promises. It's also because since they hit their high water mark, really around 1970 or so, many more workplace laws have become really commonplace. You know, when the Civil Rights Act was new back in 1964, when OSHA was new back in the early 70s, folks were still learning what those laws meant. Well, now we have things like the Americans with Disabilities Act, Family Medical Leave Act, COBRA, ERISA, all of those things that came into being since the early 70s and even later. All of those things provide protections for workers that they could only turn to unions for in the past. So whereas years ago there might have been a greater need for unions, today federal law and smart employers have made unions almost unnecessary. Here in Houston, just a few years ago, the California Nurses Association was trying to organize hospitals, trying to get some traction. And they did not have a lot of success. They managed in a very close vote to organize one hospital, but that's as far as they were able to go. And they've apparently almost thrown in the towel in the Houston area. We haven't seen a lot of activity. Now in other parts of Texas, they were able to get a little traction, but again, it's been limited. There was a flurry of activity about 3 or 4 years ago where they organized a group of hospitals, but since then, some of those employees have gotten disenchanted with the unions and decided they're not delivering on the promises they made, so we're going to vote them out. And even with an organized union who was able to oppose that effort to be voted out, at least in one case, the employees were able to vote the union out. So I would always say, and do always say, when there's union activity taking place, I would tell the people who are going to be voting and making that decision to listen carefully, ask a lot of questions, and think about what can the union provide that my employer doesn't already provide. And I say to supervisors, that's the question that your folks are going to be answering. And how are they going to answer it? Think about how you conduct yourself as a supervisor. Do your employees feel comfortable coming to you? Do you respond in a supportive, helpful, positive way, as opposed to you're really busy and maybe you don't have time? You got to make time to talk to employees. That's the way you maintain a union-free environment. So I've talked to nurses who are thoughtful and proud of their profession, and they care about patient care and they care about staffing ratios. And most of them have determined the best way to make that better is by working with their employer, working with their supervisors and managers, not trying to work through a third party who gets between them and their leadership. So the folks that really seem to care about good patient care, good staffing ratios, know that the best people to talk to about it are the people who are ultimately making the decisions, and that's hospital management. And I think that's how a lot of hospitals will remain union-free. Collective bargaining involves both sides sitting at the table and both sides saying, here's what we want, and there's some give and take there. So typically a union isn't going to get anything without giving something up. Now the employer may have some basics that they're willing to do, things that they're willing to provide for their employees, but they're not going to agree to pay wages that are out of line with the market. They're not going to agree to pay benefits that are out of line with their competitive market wherever they are. One, they can't afford to. Two, they don't have to. They don't have to agree to things. They'll agree to things that make sense. So if a union gets in, they've got to sit at the table, across from the employer, and the union will have to give things up in order to get things. And not a matter of one party, the union may want you to think that it is, sitting down and saying, here's a list of our demands. it's give and take, and the employer doesn't have to do anything. If the union doesn't get what it wants, they don't have very many choices. They can continue to try to bargain. They can ask the employees to go out on strike. The employees would vote, typically. If the employees vote to go out on strike, where does that leave them? It leaves them typically in a situation where they don't have any money coming in. And the patients are probably going to feel some impact, although most hospitals have some kind of a strike contingency plan in place, so they'll be able to bring in workers from someplace else. And depending on what the issues are, to some extent everybody loses in a strike. But that's the union's ultimate weapon. Other than a strike, they're going to just have to keep bargaining, or they may be doing some picketing or something like that. What you'll usually find in the bargaining process is that there will be some members of the bargaining unit, some of the employees who work at the facility, probably employees who were instrumental in organizing the employer getting the union in the first place. Some of them may get to sit at the bargaining table, and there may be 2, there may be 4, it just depends on how it's structured and what the agreement is, but they'll be there with a couple of other union representatives, and then there'll be some company representatives there. They'll have some input, they'll have some information, the members of the collective bargaining unit, but probably not as much as they would expect. The chief nursing executive, the chief executive of the hospital, there are some key people who set the tone for the organization. And if I look for a few minutes at the role of the chief nursing officer, I think that's a critical position, because that's the person who carries the message not only to the frontline supervisors, but who's probably going to have some interaction with the staff who's going to be voting on the contract, also has interaction with the hospital administration. So that person, that chief nursing exec, is working with people on both sides of that equation. And by setting the right expectations and making sure that they have in place the right managers with a receptive, supportive attitude toward employees, that chief nurse exec can go a long way toward maintaining a union-free environment. To look at the hospital as a whole, the nurses set the tone, the nurse managers carry that message, but the chief nurse exec really gives life to the whole mission of the nursing department. And I've had nursing directors tell me this at different times over the years. When you talk about a hospital, what you're really there for, more than anything else, is nursing care. So the nurses are, in many respects, the most vital people in the organization. And the chief nurse exec is the person who, probably more than any other single individual, helps determine what the morale is going to be like, what the level of professionalism is going to be like within that whole organization. Because nursing interacts with everybody. The nurse managers carry out the mission of the organization, taking direction from the CNO. So that's a critical person, and by selecting the right managers and setting the right tone with those managers, that person makes a huge impact on the whole organization. You always have to remember, when you talk about unions, you're talking about a third party interjecting itself between the people who work in the facility and the people who manage the facility. And hospitals are unfortunately somewhat bureaucratic because they're very complex organizations, lots of regulations, and that extra layer of bureaucracy, that extra layer of communication just creates more opportunities for things to get lost in the translation and to lose some of your effectiveness when you're trying to communicate, respond in a quickly changing environment. So, especially in healthcare, I don't think unions make a lot of sense.